This is Cadillac Unscripted on 107.9 CDY. It's sponsored by Independent Bank. My co-host is Katie Huckle. And we have a frequent flyer here on the program because, you know, we always want to talk about what our local hospital is up to because it is the lifeblood of the community.
Absolutely. A true anchor and a leader. And so welcome to Peter Marinoff, who is the president and CEO of Cadillac Munson Hospital. Welcome, Peter.
Thank you so much for having me. It's great to talk to you guys.
I understand we've got good news today, right?
I won't say necessarily good news, but, I think the initial question we always get is about COVID and how's it going? Mm-hmm. And so, as you know, the announcement's been made that the emergency declaration for COVID will actually come to an end in May. I think it's early May. I don't have the exact date in front of me, but early May. And I just wanted to share with you that we're actually looking to develop communication plans to our communities and do it in conjunction with other hospitals around the state of Michigan to kind of help our communities know here's what we can expect with the official end of the declaration for emergency and what to expect next. So I would just say stay tuned and we'll be sharing more information through media outlets to keep everybody up to date on what's happening.
And through the magic of technology, Peter, the federal, this is according to the Google search that I just did, the federal government plans to end the designation by May 11th. However, Congress is trying to end it sooner. So that is where we stand with that.
Perfect.
So Peter, from your perspective and your team, would you say that now we're going to do a better job of protecting ourselves in terms of being in large groups of people or being around people when you're sick? I mean, certainly there's a heightened awareness. Does that lead to us changing?
Katie, that's a great question. I mean, it's like a human behavior question.
Okay.
I'm not sure, how this will change the outlook. I can certainly say that during the pandemic, there are many things we learned along the way, and as far as how to try to reduce the spread of COVID, how to treat people that were infected with COVID, and then as the virus mutated along the ways, what were some things that we needed to change in delivering care? So, as far as people congregating or safety things, I have seen pattern changes within people. So, I think this past winter you would see people masking, and it wasn't necessarily COVID, but sometimes flu that they were looking to avoid. So, and just better hand sanitizing, so different things like that. But I wouldn't want to predict what may change coming out of that.
I think we are so much better informed now than we were even a year and a half ago, don't you think?
I do. Oh, definitely, for sure. We're better informed. I think it's trying to... COVID was tough because of just there were so many nuances with it, and it was a rapidly changing virus. And I think just trying to stay ahead of it presented many challenges. But definitely we learned how to maybe share things with the public. We learned how to maybe kind of make rapid change within healthcare, which is something we're actually not really good at. Not to be critical of healthcare, but I can admit to it. We're not the best with changing things quickly. So I think we learned some stuff there.
Is your team, your incredible team that got the community through this, is there a sigh of relief?
I'm not sure. I think definitely, probably with the end of the declaration, there will be some changes. So masking, in and around facilities, that will probably change. Testing will probably change. So probably there's some relief there. But I think just because the declaration ends doesn't necessarily mean the virus itself goes away.
Mm-hmm.
So, we still do have COVID.
Right. Yep.
No, and it's never going away.
Mm-hmm.
It's going to be, and I've had, Peter, maybe you agree with me on this, but I've had people say this is going to be something that we deal with like the flu every year. We go out and we get a yearly shot for it, and it's just one more thing that's on the platter of viruses that we deal with on a yearly basis. Do you find that to be true?
This will be with us for the, not only our lives, but next generation and next generation. So, we'll have to continually adapt how we combat the virus. But yes, it's with us.
Okay.
It's not going away.
Okay. So in the midst of, all of this, our Cadillac Munson Hospital has won an important award, and we'd love to have you share that with us, that success.
Yeah. Something that we're really proud of is we've consistently been, I can't remember how many years now, but top 100 hospital, but most recently, we won the top 20 hospital in the country award. We were really proud of that. And that actually happened 3 years ago. And then last year we won it again. And then this year we won top 20 again. So for 3 years in a row, we've been recognized as a top 20 hospital in the country. And when I say top 20, it's small and rural hospitals. So these are hospitals that, we're not going to have over 100 beds. We'll be under 100 beds, and we're in rural areas. But still, I think there's roughly 1,800 of these hospitals in and around the United States. And to win the award, I think it says a lot about the team. To win it 1 year is pretty tough, but to win it 3 years, I think it says a lot about the dedication of the team to deliver on high quality care. So we get measured on the quality of care we deliver, patient satisfaction, how much our market utilizes us, and then they take a look at our operational performance. And so by operational performance, I mean, are we delivering an efficient service to the community? So I would say kind of a low-cost type service to our community. Those are just some of the measurements they look at.
Is this one of the situations, Peter, like if you were to compare it to a restaurant when the health department comes in and everybody's minding their P's and Q's and it's nervous time and everyone is on pins and needles? Do you know when you are being evaluated, or is that just stretched out over a long period of time and you don't know when the hospital is being evaluated by these folks that hand out these awards?
Awesome question. So in healthcare, we actually have there's many tools that they use to measure us. So we are constantly submitting quality data. They're constantly measuring, and the feds, they're constantly measuring kind of patient satisfaction, surveys, safety metrics, submitting the financial data consistently. And so what the kind of Chartis, which is a national organization, what they do is they actually take in all of the data and they put it kind of into a grid, and then they measure it across to see how the hospitals rank out. So there's not an actual surveyor that comes into the hospital, but rather they're just accumulating all the data that is out there for the public to see, and then they put that into the tool to measure performance.
Wow. So when you go to conferences with other CEOs, this has got to be a feather in your cap, Peter. It has to be.
It's pretty special to have here. I'll be honest, if I ever do get out to a conference, which is kind of rare, I'm not exactly talking about it, but it may come up. Some people do recognize it if they see on my badge what hospital I'm from. they'll ask, hey, how do you do this? And how do you approach this? And so we might put them in touch with some of the leaders here.
Part of the award says 5-star. So are there 5 categories and you get stars in every category, or how does that work with the criteria?
Sure. So 5-star, it's a CMS ranking. So it kind of is determining, the percentile of where you rank percentile wise in relation to your peers. So, to be 5 stars, you're going to be the top 90% of a hospital performance metrics. So, the 5-star is something that helps to feed the data to win that top 20 award.
Okay, I see.
And Cadillac has been pretty consistently a 5-star facility. And most recently, there's another rating called Leapfrog. So in the fall, we were Leapfrog A, so it's the best rating you could get. I think we fully expect to probably get it again in the spring when those rankings come out. So that'll actually be, oddly enough, I think that ranking comes out either May 2nd or May 9th.
Oh my goodness! Interesting timing.
Right before the declaration of the pandemic.
And then everything changes for you again.
Exactly. You said a critical piece to all of this is your team, and you've got some exciting promotions to share with us and about your dedicated team.
Definitely, and so I'm I feel fortunate that in this fall. Kristen Brandsma, she's been with the system. She's been here in Cadillac for many years. But then I always say she was stolen by Munson Healthcare to do the good work around the system. Well, we were fortunate enough to steal her back, and so we had our longtime CNO, Catherine Banfield. She retired. And she was just an absolute gem here in the hospital. Well, obviously finding somebody to step into those shoes was pretty tough. Kristen, we were able to get Kristen to come over here, and so she'd been CNO here at the hospital since the fall. Well, most recently, we just kind of looked at reshaping some of the operations here in our South region, so the Munson South region. And what we did is we actually have her as the Chief Operating Officer and Chief Nursing Officer of Cadillac, but also being the Chief Operating Officer and Chief Nursing Officer of Manistee Hospital. So it's kind of, Kristen will actually have responsibilities between both hospitals and an expanded role into not just the nursing operations, but actually the whole operation of the hospitals.
Wow.
I've known
it's great, and Kristen's phenomenal. So
I have known Kristen for a long, long time. She's one of the nicest people I've ever come across, and her kids and my kids have been friends for a very long time. And that kind of a promotion couldn't happen to a better person, as far as I'm concerned. So, congrats to her.
Congrats, Kristen.
It is, and I can't say how fortunate I feel to be able to work with people like Kristen. Cadillac's blessed to have many people like Kristen in its leadership ranks. So yeah, this is great. So
the perspective that she'll be able to bring to the COO position is probably incredible. It
is. Well, and she has a wealth of experience, spanning, surgical operations, but also being in different facilities around the system, and so kind of blending what I would call system knowledge with some really core operational knowledge that she picked up all those years of running surgery for Cadillac.
Mm-hmm. One word would be efficient. She's very efficient.
Yes, she is.
I know Kristen too. She's fabulous.
Don't let the smile fool you. She's phenomenal with getting right down to it. So she's awesome.
Oh, well, we want to say congratulations to Kristen on that incredible promotion. And then we want to talk a little bit about the expansion of ortho in the community, and can you share that with us?
Yes. So, so Munson Healthcare, we've been working across the system to really identify areas of need for our communities. One of those was orthopedics. And so Munson Healthcare in Traverse City established the Munson Orthopedic Institute. And what they began doing was to really hire in specialized orthopedic surgeons, and then kind of working through a hub and spoke model to have some of those specialized physicians visit outreach sites in the community. So if you think about it, Cadillac, we're fortunate to have Biz here in the community, Fred with that office. But we now also have Dr. Van Wagner, who specializes with revisions and joint replacements. He can come down and join Biz to really kind of provide another support into that orthopedics office. And then we'll probably have some others coming down that specialize in maybe upper extremities or various avenues in orthopedics. I think the good news is that it will allow for us to not only just have base orthopedics in communities and phenomenal surgeons like Biz here in the communities, but we'll be able to target specific needs that maybe somebody specializes in to actually work in conjunction with that surgeon there. So in this case, it's Biz.
Okay. And do we have adequate facilities for additional folks?
We do, although, I think probably as we see the service expand, we probably will have to talk about, okay, how do we add on? Where do we add on? And what does it look like? And an example that I would have is a couple of years ago, we changed our relationship in rehab, so physical therapy, and we began partnering with Mary Freebed to deliver physical therapy services here in the community. And over time, we saw some volumes change, but we've added services on. And so most recently, we added like a spine clinic. And so that has a physician support there. And it's a new service that Cadillac previously hasn't offered. With the growth of that program, we're actually having to look at our facilities internally and identify places that we could expand it. So I'd say right now with the orthopedics, we don't see a need to expand right now, but I envision probably 6 to 9 months we'll probably have to take a look at our office space. Is it adequate? And then really take a look at our surgical rooms here and see if that's big enough, which would excite Tom, who is the surgical manager here. Tom always wants to expand.
I just heard you talking about doing an anticipation of 6 to 9 months down the road, but in your position, do you do long-term planning? Do you look at what Cadillac is going to look like 5, 10, 15, 20 years from now, try to make a prediction and try to anticipate what the healthcare system will look like to serve what you anticipate what our community will look like a generation or so down the road?
So another really good question. So I think if we went back 5 years ago, you would really take a look, and I think the strategic planning in that sense would be done locally. And it would be solely a function of our board, the leadership team in the hospital itself, identifying that what the predictions were. And a lot of the plans, honestly, really, they maybe stretched 5 years. They did not go too far into the future. What we've done over the last few years is we've really had to look at resources available, not just here locally, but across the system, and understanding what the different community needs are and building out services around those. So that's a long way around to saying we still do strategic planning, but it's not only done at a local level, it's also done at a system level to really identify, okay, they need to add this in the Cadillac community, and it's going to cost $10 million. So we're going to utilize system resources to help cover that that addition in the community. But again, we're probably looking out more 3 to 5 years on these initial plans. We're not really stretching 10 and 20 years because things can kind of rapidly change in healthcare, and especially over the last couple of years, we saw a lot of disruption in healthcare, and it's hard to, if you're developing a plan for 10 years out, it's hard to really dedicate to that path.
If you had another COVID, God forbid, something
Right.
like that come up in the next 3 to 5 years, yeah, you'd have to throw your plan out the window, wouldn't you?
Pretty much, I think pretty much. And, you know, and again, what's made it pretty interesting is we've seen a lot of retirements in healthcare, and we've seen a lot of shift of people, you know, young people going into different professions. So there, you know, I think you have to look at some resource needs, and you think, boy, it'd be great to have this service in the community. But then you also have to ask yourself, can we recruit the person here and keep them here? Because you don't want that turnover, because it does impact, you know, the ability to meet the needs of the community around you.
Peter, what can the community do to support the hospital? I mean, we really love hearing these stories of, you know, being in the top 20. It's a source of pride for the community. But what can we be doing to support and promote the hospital?
I'll be honest. I think not much different than what's happening now, and that is, I think Cadillac does a great job of kind of working collaboratively with the hospital. So whether it's CTC with programming, whether it's Baker College with programming to educate young people to come into healthcare professions, or, you know, even the, you know, CAG, so the industrial group around here, they identified a need and they said, Peter, you know, we need occupational health and medicine. There are certain things that are a gap for us. And it gave us the time to explore, could we bring that into the community? And we were able to add it this winter. So it's really the community super supportive in always providing feedback, always engaging with the hospital to say, you know, this would be a great service to have here, or, you know, this was my experience in the hospital, and allowing us to do deeper dives. So the community's been supportive, and we couldn't ask for anything more.
I do want to build on something, Peter, that you just said, because earlier this week I attended a staff meeting at the Career Tech Center, and we do celebrations of success. We talk about, you know, the individual programs and what they do. And this year, and Katie, this will be new information to you, the Health Science Careers class at the Career Tech Center has 39 students.
Oh, my.
All 39 passed their CNA.
Incredible.
39 for 39, 100%.
I'm getting the chills.
That's awesome.
Wonderful. It is awesome. They took it seriously.
And
They're committed.
And we appreciate Munson's commitment to the CTC to help get our kids who are interested in healthcare into that field.
Awesome.
It is, and you know, I can't say enough about them, because it's the preparation for these young people to enter healthcare. They're entering the field, and they are ready to jump in. And it's just it's just great to see.
And that's
so
where
that's a great example.
That's where the new blood comes from, Peter. I mean,
Sure.
you're recruiting from the people who are just getting out into the workforce. So hey, Jill Doan and Lynn Hughes, way to go over there at the hospital.
That's a good shout out.
And I wanted to dovetail on the community is supportive, but the leadership of Munson is receptive. So it takes both. It's okay, I have an idea, I've identified a need or an issue, and then, local leadership with Munson saying, let's sit down on the table and talk about it. You used a word that's so important, which is, collaboration. And we see that we see that in education. We need to use your high school theater for our performance of whatever, or the chamber needs to borrow chairs, or, we see this across all different walks of business, if you will, business and education, business and the medical community, the business community. And I think that's an expectation in our small community is we have to work together to get things done. We have limited resources, but let's maximize our limited resources, if that makes sense. So hats off to you guys for new programs and identifying talent. And like you mentioned, industry and manufacturing and your collaboration there. It's just really great progress, I think.
That's kind of point out that's what makes small communities great. It's the collaboration.
Mm-hmm. Right. We mentioned capital investments in the community. Is there anything else, Peter, you want to cover? The spine clinic is exciting. Is there other stuff that we need to know about that could be coming down the pike?
Not really. I think we're ending we're kind of coming into the fourth quarter of our fiscal year. So this is usually the time that we start making out plans for the next fiscal year. So, I'd say the next time we meet, I might have some more exciting things to talk about for you guys.
Well, today was all good news. Yeah. Yeah. So, just a shout out to your team for getting us through a really hard time. And I think this announcement really helps people with, like you said, it's never going to go away, but that have been anxious about what does the CDC say or what do the professionals say? Where can folks get information on this? Peter, what's the best place for them to go to find out about, the end of the pandemic, if you will?
I think for the time being, I would say stay tuned. Munson Healthcare will make sure to get to all media outlets and get that information out to people of what to expect with the end and what it could mean for you and your family and neighbors. So I would just say stay tuned.
Okay.
Perfect. Well, Peter, we always appreciate having you on the show. It's been a very warm mid-April week, and the next time we have you on, probably in maybe July or August, it will be like it's supposed to be at that time. So we'll look forward to then.
Thank you, and Munson. Thank you, Peter, also for everything you and Munson are doing for Cadillac.
All right. Well, thank you guys for having me on, and just I always love coming on. So thank you.
Peter Marinoff is from Munson Healthcare Cadillac Hospital, and we'll look forward to visiting with him again in a few months on Cadillac Unscripted, which is sponsored by Independent Bank. Join us next week, same time, same station, for more great local chat on 107.9 CDY.